Well, over 100 pregnant women have been hospitalized with COVID-19 in our state alone. And joining us now is Singing River Health System OBGYN Dr. Gaddy to calm some fears for expectant mothers. And Dr. Gaddy, these are certainly difficult times, and it's hard for people to know what to do, especially pregnant moms, because, I mean, we're all told not to put anything in our bodies we don't have to, and then we have this vaccine that is new to everyone. And now the CDC is recommending pregnant women get the vaccine.
That's correct, and that's been somewhat recent recommendations by them. Initially when COVID started over a year ago, there really wasn't a lot of statistics that we knew about in pregnant women. And in fact, the original COVID did not seem to harm the younger pregnant age women at that time. But this new variant that we've had has been especially injuring pregnancies that we've seen. And so there's a lot more worry about this new variant than there was with the original variant.
Well, Dr. Gaddy, tell me what you're seeing, what doctors are seeing as far as pregnant women who aren't vaccinated and how it may be affecting them and their babies.
Unfortunately, we're seeing a big increase in number of pregnant women that we've had to hospitalize, and it's almost all related to people who are unvaccinated. And I can understand why women have not necessarily jumped in there and gotten vaccinated, especially pregnant women. And then there's some misinformation about it causing fertility problems that is unfounded and has no scientific evidence. And so it does not cause fertility problems to get the vaccine even before you're pregnant. But we have seen a significant increase, and there has been unfortunate outcomes, especially recently, in women either miscarrying their pregnancies or worse yet, those women getting admitted into the ICU. And there's even been quite a few deaths in Mississippi of pregnant women. And that's just something that we really did not expect, because most pregnant women are young, and we thought that it was not going to affect young women. But
right, so you're recommending the vaccine now for women along with the CDC, and also I think only 23% of pregnant women in the U.S. were vaccinated as of July, but now that this CDC recommendation has come out, I think just about a week or two ago, really kind of pushing this, do you think more women are going to get vaccinated, and what are your concerns if they don't?
I certainly hope they will get vaccinated. American College of OBGYN and the maternal fetal medicine groups have recommended that all eligible persons, including pregnant and lactating or breastfeeding women, receive the COVID-19 vaccine. And there's no evidence of any adverse maternal or fetal effects from the vaccine in pregnancy. And they've got lots of evidence of giving the vaccine in pregnant women.
Yeah, I'm glad you also mentioned that about fertility, because that's another question that has come up a lot, and you have not seen any issues with that in your vaccinated patients, right?
No, not at all. And there's good evidence that that was a lot of unfounded misinformation that somehow got out on the media, on Facebook or on YouTube, and it just doesn't make sense, and it has not come. We have not seen any of that.
All right. Well, hopefully, after hearing this, more women will consider the vaccine and talk to their doctors about it. Dr. Gaddy from Singing River Health System, thank you so much for joining us today.
Thank you.